infectious diseases. Here we can look who is most at the risk for getting the infectious diseases. Anyone can get an infectious disease. You may be at an increased risk if your immune system is weakened or if you travel to area with certain highly transmissible diseases. People at the higher risk of infectious diseases include those with suppressed or compromised immune system, such as those receiving the cancer treatment, living with HIV or certain medicine, young children, pregnant people, and adults over the 16, those who are unvaccinated against the common infectious diseases, and healthcare workers and people who is traveling to areas where they may be exposed to mosquitoes that carry the pathogens such as malaria, dengue virus, and Zika virus. These are the major people who are at the risk for getting the infectious diseases. So here we can look for the what are the complications that are associated with the infectious diseases. Many infectious disease resolve without complication, but some can cause the lasting damage. Serious and the life-threatening complication of various infectious diseases include dehydration. This is caused due to fever, vomiting, and the diarrhea. Pneumonia. This is the respiratory illness due to viral or the bacterial infection. Sepsis. This is also a bacterial infection, and the meningitis, which is a swelling of brain. Multiple causes can be caused by meningitis. This includes the bacterial, viral, fungal, and the parasitic infection. AIDS, which is caused by human immunodeficiency virus, and the liver cancer, which is caused by hepatitis B and C, and the cervical cancer, which is caused by human papilloma virus. What are all the symptoms of the infectious diseases? They all depend on the type of illness. Fungal infection usually cause the localized symptoms like rash and itching. Viral and the bacterial infection can cause the symptoms in the many areas of your body like fever, chills, congestion, cough, fatigue, muscle aches, and the headache. Gastrointestinal symptoms like diarrhea, nausea, and vomiting. It is important to see a doctor if you have a chronic ongoing symptoms or the symptoms that get worse over time. What causes the infectious diseases? They are caused by a variety of agents that invade your body from outside. These include the viruses, bacteria, fungi, parasites, and prions. You may develop the symptoms when your cells are damaged or destroyed by the invading organism and as your immune system responds to the infection. How do infectious diseases spread? Depending on the type of infection, there are many ways that infectious diseases can spread. Fortunately, in most cases, there are simple ways to prevent the infection. Your mouth, your nose, and cuts in your skin, these are the common places for the pathogen to enter your body. Diseases can spread from person to person when you cough or sneeze. In some cases, droplets from coughing or sneezing can linger in the air. From close contact with another person, like kissing or oral and vaginal sex, can also cause the infectious diseases. By sharing the utensils or cups with other people can cause the disease. On surface like doorknobs, phones, and countertops, through the contact with the poop from a person or the animal with causes an infectious disease. Through bug or the animal bite, and from the contaminated or improperly prepared food or water, from working with the contaminated soil or sand, and from a pregnant person to the unborn baby, and from the blood transfusions, organ or the tissue transplant, or other medical procedures can also cause the infectious diseases. How are infectious diseases are diagnosed? So, your healthcare provider usually diagnoses the infectious disease using the one or more lab tests. Your provider can look for signs of disease by swabbing your nose or throat, getting blood, pee, urine, stool, or saliva samples, taking a biopsy or scraping a small sample of a skin or the other tissue, getting imaging like X-ray, CT scan, and MRI or of the affected parts of your body can also be diagnosed for the infectious disease, and some test results like from the nose swab come back quickly, but other results might take you the longer time. For instance, sometimes bacteria has to be grown in a lab, cultured from a sample before you get your test result. So here we can look how all the infectious diseases are treated. Treatment depends on what causes the infection. Sometimes your healthcare provider will recommend monitoring your symptoms rather than taking the medication. Bacterial infection can be treated with the antibiotics. The right antibiotic depends on what the bacteria causes the infection. You can manage most viral infections with over-the-counter medication for your symptoms until you feel better. If you have flu, your healthcare provider may prescribe the oseltamivir phosphate Tamiflu in some cases. In certain viral infections have the special medications to treat them like the antiretroviral therapy for HIV. Fungal infections. They can be treated with antifungal medications. You can take them orally like fluconazole, tiflocan, or put them on your skin just where the fungus is clotrimazole, clotrimine. Parasites can be treated with the antiparasitic drugs such as mebendazole. There are no treatments of the prion diseases. What is antibiotic resistance? Antibiotic resistance is when the bacteria develop the mutation that make it harder for a medicine to destroy them. This happens when antibiotics are overused, such as for the minor infection that your body could fight of its own. Antibiotic resistance makes some bacterial infection very difficult to treat and more likely to be life-threatening. Methicillin resistant Staphylococcus aureus. This is an example of the bacterial infection that has some antibiotic resistance. Healthcare providers are working to reduce the antibiotic resistance. You can help and protect yourself by finishing all of your antibiotic medication as prescribed. This helps to make sure all of the bacteria are destroyed and can't mutate. The next topic we're going to see here is, can infectious diseases be prevented? There are many simple ways to reduce your risk of infectious diseases and even prevent certain illness altogether. While each of these helps to reduce your risk of getting and spreading the infectious diseases, often there's no single way that is 100% effective at preventing the disease. That's why it is important to have many habits for reducing your risk. You can think of it lining up the slices of Swiss cheese, a model suggested by Rebus recent PhD, where some slices have the holes, other slices gives the protection. Getting recommended vaccination and simple habits like practicing the safe food handling and washing your hands work together to give you a layers of a protection. This is the Swiss cheese model for the infectious diseases. The first thing we have to do is vaccination, then we should go for the hand washing regularly, safe food handling and cleaning and disinfecting. James Reason's Swiss cheese model applied to the infectious diseases. Even if the protection isn't perfect, the more layers of a protection you add, getting vaccinated, washing your hands, and safe food handling, cleaning and disinfecting, this can lower your risk of getting and spreading the infectious diseases. Now we can go for the vaccines. Vaccines reduce the risk of getting an infection disease by training your immune system to recognize and fight off the infection from the harmful invaders. While people sometimes do still get risk sick with the disease after getting vaccinated for it, your symptoms are usually less severe than they would be without the vaccination, usually given as a shot or the series of shots, less commonly as a nasal spray. Vaccines are available for many common infectious diseases including the chickenpox, COVID-19, diphtheria, tetanus and pertussis, whooping cough, hepatitis A, hepatitis B and human papillomavirus. Safe food handling. These are the habits that help prevent the certain infectious diseases. Wash your hands thoroughly with soap and water before, during and after the food preparation. Peel or thoroughly wash all the fruits and vegetables. Freeze the meats at 0 degrees Fahrenheit or minus 18 degrees Celsius until ready to throw. Cook the meat to be safe temperature before eating. Wash food preparation surfaces and utensils with soap and water after use. Don't eat uncooked and undercooked seafood. Don't drink untreated water. Don't drink unpasteurized milk. Other ways to help prevent the infectious diseases, in addition to vaccines and safe food handling habits, you can reduce your risk of coming down with spreading an infectious disease with a few everyday practices. Wash your hands with soap and water. Thorough hand washing is particularly important before preparing a meal or eating, after using the bathroom, after contact with food, animal or human, and after gardening or working with dirt. Cover your nose and mouth when you sneeze or cough. This Disinfect frequently touched surfaces in your home and workplace. Avoid contact with people who are risk with an infectious disease or sharing the personal items with them. Avoid contact with others while you are sick with an infectious diseases. Don't drink from or swim in water that could be contaminated. Wear a mask around others when you are sick or as recommended by the CDC. Use a condom during any kind of sex. To reduce the risk of tick or the mosquito bite, use bug repellent approved for ticks and mosquitoes. Discover as much as exposed skin as you can with the clothing and check for the ticks after being in the wood or areas with long grass. What are all the outcomes after the treatment for the infectious disease? With treatment, most people get better after being sick with the infectious disease. Sometimes there can still be serious infectious complication, especially with the respiratory illness. People with a compromised immune system are more at the risk for the serious complication, but they can be happen in the healthy people too. Some diseases like HIV and the hepatitis B can't be cured, but medication can help prevent the serious complication. Sexually transmitted disease can cause the infertility or even lead to cancer. So it is important to take steps to protect yourself and others. Prion disease are very serious and can be cured. They are fortunately some of the rarest infectious diseases. Thank you.